Of course, I'm sure that we'll be mentioning this, and many of you here will know about the 1 in 5 strokes due to AF, about 3,000 a year in the northwest, and it's rising. So this isn't going to go away. This is an important issue, and as Les said, a lot of the academic health science networks have been tasked with tackling this. It's a national priority. Just in terms of making sure that people are identified and also managed, and also there's a whole issue about how people are managed, as Liz mentioned, looking at including sort of patients' wishes and desires to become empowered over this issue and not be overly debilitated by it. There's massive cost implications. So of course, you know, anybody you talk to in any area of healthcare, there's costs going up. So whether it's AF and it's stroke, or it's cardiovascular disease, or it's mental health, you know, there's a big cost implication. And I think that if you address the costs early through innovative approaches, that's actually going to stand us in good stead for the future. The costs aren't just the pounds and the pence, they're also the cost of the individuals. And if somebody does have a stroke, particularly one caused by AF, there's an awfully big cost to the individual in terms of the way they're able to, you know, manage their lives in the future. But there's also a cost to families and supporters and carers of those people in terms of the stress and the energy that they have to put into supporting that person. So there's much wider costs involved. Can everyone hear me still? It feels like this is going a little bit funny. Anyway, so we had a look at the costs in our area, particularly the Northwest Coast. So we wanted to look at where we can make a difference. As you can imagine, we're being tasked with actually reducing costs in our area. So we have to be able to produce a baseline that allows us to look at what the costs currently are. We've got potentially a saving of over £4 million a year in the Northwest Coast if everybody who had, if medicines were optimised and everybody was being managed. Well, I'm going to try a different. So basically, we reckon that we can make some really big savings in this area, and we can also help individuals too. There's you know, £103 million spent on AF in 2012-13. I mean, it's a big number, and I think sometimes we get a little bit caught up in the big numbers, and we go, oh, you know, that's terrible. It's 100 million, but actually, you've got to break it down. You've got to look at your area, you've got to look at your service, and you've got to look at individuals as well. So actually, sometimes the call to action is actually looking at individual services rather than actually looking at a big number, and you think, oh, you know, that's terrible. You know, that's going to be a really difficult job. We have to look at how we're doing things individually, and we have to be sensible and use common sense. We're working with a whole range of partners to work across our programme. We're doing awareness raising with the public, we're helping with the identification, and we're also supporting colleagues with implementing NICE guidelines and NICE approved technologies. It is difficult to bring new things into practice. Yeah, I put on a pair of shoes this morning and I thought, I'm not sure if I should wear them, they might be uncomfortable, I haven't worn them before, but I thought I'll give it a go. Actually they're all right. But you can ask me again at the end. So sometimes technology is a little bit like that. You think, oh, it looks like it might be all right. I like the look of it, but you know, if I actually use it, is it going to be terribly disruptive? We can help with that. We can try and take some of the pain out of doing things differently and doing things newly. And we also want to create an environment where we can help people think differently, and also to actually look at what possibilities are out there. We're doing our campaigns, we're looking at technologies in a range of environments, and you're going to hear from Dr. Umesh Chawan in a moment about some of the work he's doing. We're using technology, we're looking at a live core and My Diagnostic, which you can see around the room. We've also got some technology that turned up on spec that we're pleased to have with us. So there's some extra stuff around sort of monitoring and Holter technology that we weren't expecting to come today, but we're delighted to have with us. We're looking at doing things differently in terms of genotype guided dosing. We're supporting partners with providing them with support on technology reviews and technologies that can sit alongside those reviews. So we're delighted to have the launch of the Strategic Clinical Network CCG Commissioning Toolkit today as well, and Jeannie Hayhouse is going to be talking a little bit more about that as well. We're also looking at things that can help us in terms of education. So we hear a lot about people not feeling confident in anticoagulation. So we're looking at sort of new models of care and also in terms of the management of AF generally. So we're looking at online education at the moment. So if anybody wants to try the online education, I'd be delighted to speak to you afterwards. I want to make sure that we get some good feedback to see whether it is something that's suitable for our area or not. One of the things we need to do is eliminate things that aren't helpful as well. And sometimes we need to do some sort of small scale evaluations, look at how it works in practice. We're looking at the Alive Core being used with general practitioners. So we've deployed about 83 units so far across the community. We're willing to deploy more. If people are interested in using that technology, we can find a way of getting it out to them. We cannot achieve what we've achieved without our campaign partners. So I'm going to talk a little bit about our AF awareness raising campaign in Lancashire, which has recently come to an end. We can always achieve more with more people, and everybody who we've worked with has pitched in and provided us with amazing support, right through from the football clubs through to the charities, and also support from Technomed and Alive Core with the devices. So we're very, very pleased to have our campaign partners. We want to make sure that we carry on with our engagement and that we develop those relationships in terms of technologies and innovation in the future. So we know that we can achieve a lot for quite a little cost when we've got partners involved who are supporting us. So the main resource that we found with this campaign has been actually people's time and engagement, and we've had some wonderful engagement. So our campaign in Lancashire, we ran a similar one in Merseyside last year, so we wanted to do something in Lancashire this year. We'll be possibly thinking about doing another one next year, because these campaigns really seem to provide a good focal point for getting people together, actually raising awareness with the public, which is really important, and also making sure that we've got the profile of this campaign suitably pitched. So we've had a number of workshops. We've had some meetings and events that we've dropped in on, and we've also had some specific drop-in events that we publicise locally. And we've had them in sort of the general Preston area. So Preston, Chorley, Padiham, Blackburn have been some of the events that we've been involved with. We've done a big part of these campaigns is the promotion and the comms. So we've engaged with partners and we've deployed a network of communication. We've had interest from local radio. We've had support from local celebrities such as Bill Beaumont and George Ross, who've raised our ability to get into the local press. We tested over 500 people. We were very keen that we should get over 500 so we could say we tested over 500 people. We had an aim to go for 500, so we managed to get that, which was great. We identified 34 abnormal pulses. Now, we wouldn't diagnose them because that's not our role, but we suggested that they do pay a visit to the GPs. We also outlined that not all abnormal pulses mean that it's AF. We think that, you know, if even one of those has got AF that was unidentified, that has the potential to help that person and also to help the NHS to manage them. We've produced an evaluation of the work, and we've also got a toolkit, which I've got copies of the toolkit with me. If anybody wants to have a copy of that, I'll make some available on the table at the end. We used the diagnostic stick, which was very good working in big venues. So we'd recommend that for sort of events and opportunistic testing. When we did get somebody who came up with a red cross on the stick, we also cross-tabulated it with the Alive Core device as well to get another reference. Again, as I mentioned, it's quite low cost. These are the results. We had slightly more younger people that we identified than we expected. But actually, in terms of comparison with the wider population, the prevalence that we got was very similar. We did do an event at Edge Hill, so we had a few students coming through. So although we aimed the campaign at the over 65s, a lot of people came and they were interested. One of the things about using technologies in opportunistic testing is it does bring people over because they're interested, they want to have a go, they want to have a look at it. So that's quite a draw, we've been telling people how to take their pulses as well, but the stick provided a good focal point for discussion, and people wanted to know how it worked and such. So we've got more people identified. We're hoping that we're going to be supporting with getting more people treated appropriately. We want to make sure that we work with, well, it's not just us, but lots of people that we can actually provide a bit of a catalyst towards reducing strokes caused by AF. We'll also be hopefully reducing the costs associated with that. So we're very mindful that all our work needs to have an economic element to it in terms of the evaluation. We want to help support our clinical staff as well. One thing I should say is that we can't do anything that we're doing without all of you talking to us and telling us what you need, and continuing the dialogue that you have with us. I know that we've got a lot of good conversations going on at the moment, and we've got a lot of good connections. We want to increase this, and as this programme matures, we'll be building on and developing that. We don't always have the answers. We can suggest things, we can create an environment, we can show things, but actually the people who are working in the front line possibly do have a lot more of the answers than we do, and also a lot more of the questions. How can I do this? How can I do that? Sometimes we can help people with horizon scanning. We've got a lot of expertise in our departments in terms of data management and health economics. So we can, if we don't know how to do it physically ourselves, the chances are we can put you in touch with somebody in our partners who can. And again, the partnership is really important. We're a network. We work in a networked way, and we want to make sure that we continue and develop that. And as we've sort of over a year into our AF campaigns, the networks that we're building are growing, and the conversations and the relationships are developing. So, it's a real delight to work with all of you. So that's enough from me. I'm going to hand over to Louise Winstanley, who is going to come over, and we were very keen at this event to get a range of different perspectives. So Louise is going to give us the pharmacy perspective in primary care.